Of sexual and reproductive health and rights is a basic human right enshrined in the Constitution, but thousands of women still resort to illegal and unsafe abortions. As we commemorate Women's Month, we reflect on the gains, especially in the health sector. So to explore this further, I have in studio with me Dr Melusi Dhlamini. Dr Dhlamini is in obstetrics. He's a gynecologist and a sexual and reproductive health clinician and activist as well, most on Twitter. Good afternoon to you. Thank you so much for coming through.
Thank you for inviting me.
Yeah, so let's start with this My Body, My Choice campaign. What exactly does it mean to you as an individual? And of course, the work that you do.
Well, My Body, My Choice is actually a campaign that we're running on Twitter and all other social media platforms. Basically, what it means for me is that you have the right to choose whatever happens to your body. And that choice is informed and it has no restrictions. That's basically what it means to me.
And how has the response been? I know you at times go live on Twitter with a particular topic relating to this reproductive health issue. What are people saying? How comfortable are they to talk about these issues?
The response is good. We usually have what you call a Twitter view or a Twitter chat where we discuss a certain issue and we invite people to ask questions during that Twitter chat. Usually the response is good, but you know, the response might be good, but you know, that information is reaching people that have access to internet, access to phones, access to Twitter. It's reaching people that already have access to information.
Yeah.
So it's kind of worrying. How do we get that information to other people that are in poor, marginalized communities? And I think that's what we should actually be looking at doing.
Yeah, exactly. Now, the issue around the stigma on abortion, how do we ensure that women are not denied proper healthcare services when they want to abort?
You know, the thing about abortion stigma is that it can be concealable, so you wouldn't know, because we live in a community that sees abortion as wrong. So we ourselves might think of abortion as wrong. So when somebody is saying something wrong about abortion, you might not actually realize that they're actually saying something wrong. So you hear things like abortion is dangerous, abortion will give you cancer, if you have an abortion you might have fertility issues in the future, you know, those kind of things. So when people say that to you, you don't see it as stigma, you just see it as fact, because that's all you've had about abortion. So, you know, the reason why we're actually talking so much about abortion is to try and get as much information out there, which is actually true about what abortion really is. If we don't talk about abortion, what abortion is, we actually letting people that are anti-choice, that movement, to drive their agenda, which is basically to make sure that stigma stays alive in the communities.
Yeah. And indeed it is there, stigma and some societal pressures. You know, things that people say that when you abort, you're a murderer, you're antichrist. So those are the things that people have to go through.
Yeah. Even as providers, you know, you get some negative comments. There's a lot of attitudes and beliefs that are negative and false about abortion, and that's exactly what's driving the stigma on abortion.
People calling you names as well.
Yeah. You know, just last week, to give an example, somebody at work, a nurse, she was saying that she's praying for us, you know, abortion providers. There happens to be about 2 of us at work. So I asked why, because she said we must stop doing abortions. I said, why? We don't need abortions. So I couldn't continue with the conversation, because clearly we're not on the same wavelength. Because if you as a healthcare worker says that we don't need abortion, what are you even talking about? Can we not even have that conversation at all? If you're gonna talk about abortions, please come with you know, correct information. Don't tell me that you don't need abortion as a healthcare provider. But
what does it signal? I mean, the person you're referring to is a healthcare provider who should know better. What does this signal? Is it still issues around the stigma, or is it perhaps some lack of information on the topic itself? Because I would want to imagine that if you are a nurse, a healthcare worker, you should have information on that topic.
I think it's a lack of information, a bit of ignorance, Because if you look at the history of abortion in South Africa, abortion used to be very rife. The death that there was from abortion, septic abortions we call them, because women would go back streets, stay at home for days, bleed basically to death. That was before the CTOP Act came into action in 1996. Abortion used to kill a lot of women, and since abortion became legal, and we had an act that was that addresses, how and where abortion should happen, we've seen a dramatic decrease in the deaths that result from septic abortion, resulting from illegal abortion or backstreet abortion, as we call them.
But you still get those women who opt for doing it the illegal route. What could be the reason, really, or perhaps should I say, are there any barriers to proper healthcare services that provides abortion?
Yeah, if you look in South Africa in general, health in general, there's very clear inequalities in terms of how healthcare services are spread out throughout the country. So if you have somebody in the deep rural KZN, they wouldn't be as lucky as somebody who stays in Soweto, because in Soweto you would have hospitals, clinics, probably 5-10 in the same area that offer safe abortions. In your deep rural villages, you would have to travel probably 3 taxis just to get a safe abortion, or a facility that offers free and safe abortions. So the inequalities in terms of how the healthcare services are spread in the country, that's where you get your barrier to accessing safe abortions. So those girls, doesn't mean that they're not going to go for abortions in those communities, doesn't mean they don't need abortions. They will go, and the first thing they see is that poster downtown that says quick, cheap, safe by Dr. Lerato, and that's exactly where they will go, because they are so desperate to not be pregnant anymore. They are so desperate to get an abortion, and they don't know the difference between that Dr. Lerato poster downtown and an actual safe abortion provider, which is funded by the government, provided in a government facility. The other thing is lack of information. We don't know what the law says about abortion in South Africa. So if you go around the country and just ask girls or anybody of reproductive age, what is the law on abortion? A lot of people won't be able to tell you what actually is the law. Yeah. So if you don't know, you won't be able to do right. So you don't know that the government allows you to have an abortion, safe and legal abortion, in a designated facility up until you're 20 weeks pregnant. So they will come late, and once they come late, there's nothing we can do about it. Yeah. So what do they do? Because they are desperate to end the pregnancy, they go back streets.
What about the healthcare providers' attitude towards those who come seek help?
There's this thing we call conscientious objection. Very badly regulated, so people hide behind that because everybody applies it the way they see it. There's no clear protocol or guideline that says this is what objection is, this is how it's supposed to happen, and this is what could happen if you don't abide by those rules. So because there's no consequences if you basically act as a barrier as a healthcare professional, people just do whatever they want to do.
But how can we contain the situation? I was reading a shocking stat here that revealed that more than 3,000 children aged between 10 and 14, that was last year, became mothers in South Africa. I think this talks to the issue of birth control, the accessibility of birth control measures. When you and I were growing up, we were told to abstain. But obviously with these numbers, it shows that abstinence it's not on the card for our kids now. How do we go about addressing the issue of birth control so to address the issue of abortion in the future?
Remember, abortions happen because pregnancies are unwanted. So how do we prevent unwanted pregnancies? Can we teach our children in school comprehensive sexual education? If we can actually teach our children about sex, that if you have unprotected sex, then you are at risk of actually becoming pregnant, then they will actually make better choices, because then we know if I'm having sex, I'm probably going to get pregnant, and to stop that from happening, I need to be on contraception, or I need to use a barrier method, a condom. So if you teach our children, we give them that power to make those choices about their sexual lives, then I think we can actually prevent some of them.
It's entirely up to us as parents to take charge of the situation, because government is providing these measures. They are readily available at healthcare facilities. So it's up to us as parents to do something, talk to our kids about these issues.
I think we need to start at home. Even when our children go to school, they should be getting the education to build on something that has already has a foundation that was laid at home. So I think we need to be open about sexual education. Obviously, talk to your children appropriately, according to age. But we need to be open about sexual
Quickly,
matters.
what's an extreme case that you've had to deal with due to illegal abortion? A very quick one on this.
It was 2017. I think I had 2 deaths in that year. But basically, somebody went back street. They stayed at home for, I think it was about 7 days, and she was bleeding. And when she was very weak and not talking anymore, the family took them in, but they didn't say that they actually went for an abortion. But when you look at the history of actually what happened, you can actually see, and we actually lost that person. We used to get to ICU, didn't last long in ICU, and they died.
So people can lose their lives due to illegal abortions. All right, Doc, we have to leave it at this. We'll see you on Twitter. Thank you so much for coming through.
Thank you for inviting me.
All right, well, there you have it. Dr. Melusi Dhlamini is a doctor in obstetrics and a gynecologist, sexual and reproductive health clinician, and an activist, of course, talking to us about illegal abortions in South Africa and how we can go about avoiding getting to that situation.